Good afternoon. And today we have an honor of interviewing Dr. Susan Maple, author of two wonderful books, Brave Parent and Blabbermouth. So good afternoon,
Thank you,
Susan.
Maria. I appreciate you and love being here.
And of course, I want to mention, in addition to writing the book, Dr. Maple has experience in the dental field for 39 years. So she's seen a lot and experienced a lot. And again, thank you to our audience for listening. If you have trouble sleeping or your child have trouble sleeping and you witness that, please click the like and share button. If you're medical professional, I think this program would be great for you because you can learn a lot about practical recommendation for children and adults. And most important, what with people like Susan, we can create community and make the world a better place.
Awesome.
And and I would like to give my personal story. Of course, I read the book. I really enjoyed the book. I find some tips for me as a parent, as well as a dentist.
And a
Uh,
person.
and a person, yes, true. So it was significant impact your book made on me. And I really want, we're going to put the link for the book in underneath the interview, and I really hope every person or every parent for sure gonna read the book. And it was some important part, like I'm big proponent of myofunctional therapy, and I really like what you cannot have a straight teeth in a crooked face. I absolutely love a description of internal face you made. So it was a lot of practical recommendations. So my first question to you, Susan, would be, what was the inspiration for you to write your books?
Well, first of all, the book is called Brave Parent Raising Healthy, Happy Kids Against All Odds in Today's World. And the reason for the inspiration is the same as the subtitle, which is really it is against the odds to have kids grow up to be healthy adults. After practicing dentistry for now 39 years in the same place, I've seen a lot of my babies grow up to be sick adults. And I keep asking myself, what can we do sooner? What can we see sooner? And how do we predict and preempt these 100% avoidable lifestyle related problems? And over my career, I have been really doing the research to figure out what are those key health issues that we see. Everything from obesity and diabetes and cardiovascular disease, but also addiction and depression and anxiety and sedentary activity that causes all kinds of other metabolic challenges, all kinds of allergies and autoimmune problems and asthma. So I wanted to tackle all of these things that we consider avoidable. 75% of what we're paying for in healthcare is preventable to begin with. How do we start with a baby and do it differently? So that was the inspiration.
That's great. I really feel it with every page. So I'm going to ask you the first question. It's about food. So, what would be the practical steps to instill healthy eating and drinking and exercise habits in children from early age?
Well, that is a huge question. I think my first answer would be model it. Model it. Because kids, as it turns out, are really good mimics. They do what you do, not what you say. So you can say all the right things, but if you're acting differently, they will, which means we get to grow up with our children and make some changes and let them know that we're human and we're trying also. Now, there's an awful lot in the book and that we could cover on relationships to food, which in our country are a mess, and food itself, as well as what to drink, if anything, besides water. And even among water, what kind of water? And is it okay to drink tap water? Is it okay to drink sparkling water and water in a can and water in a bottle and all of these things? So there's a lot to talk about there. And you also mentioned exercise in there. I mean, these are huge sections in the book. But I would say number one is to work with your children to take a look at your own behavior and address some of those and say, look, I don't want my child to grow up with some of the health challenges that I have. I would really like to see how I can get healthy along with raising them on a better trajectory so that we can help kids become who they're supposed to be, right?
Yeah, this is a beautiful answer. Now I'm going to make it a little bit more precise towards eating. Yes, I like how you mentioned in the book what taking the food in should be celebration with a candle and a good, utensils and all of that. Yes, sometimes we say we don't have time for it, but I think it's very important to create the mood for, that process. So how can we emphasize and expose our kid to make a better food choices? What would be the guidance to provide balance and nutrition diet for children, especially in the context of many families have hard time adopting healthy eating habits?
Well, I like to say to parents, like, our job, like, children are going to eat when they're hungry. We are animals after all, right? We are born with the ability to feel hunger. We mute that out by a whole bunch of things, including sleep related breathing disorders, including ultra processed food and sugar. We start to mute out our hunger so that we eat like the same thing every day, whether we're hungry or not. And then we, sort of overindulge without recognizing it. But kids won't do that. They're born with the ability to know when they're hungry and when they're not. Our job is to provide healthy food options that are safe and fresh and palatably prepared. And their job is to eat when they're hungry and not when they're not. So we need to stop controlling their eating, but at the same time, we just can't offer foods that are not healthy for their bodies. So when you look at ultra processed food, oh my gosh, there was a big study that came out just a couple of months ago on the huge increase in in pharyngeal and esophageal cancer from ultra processed food, not from obesity. We know obesity is related to 20 different cancers, but from the food itself, the emulsifiers, the flavorants, the thickeners, the colorants, the plastic that it's packaged in. We have to move away from ultra processed food. Buy real food, learn to use a knife, chop, 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 provide fresh, healthy food, and get out of the way. Your kids will eat when they're hungry and not when they're not. They don't have a credit card. They don't have access to the grocery store. They don't have a car. They can't carry bags. It's up to you, parent, to own your refrigerator, pantry, food cabinet, table. You own it. You provide good food and let them eat when they're hungry. And if they're not hungry, they don't have to eat. That's it.
But I'm going to ask you the question as a parent. When my boys were growing up, I had a hard time exposing them to variety of food. Can you please talk about your strategy of polite bites?
Sure. We have 8 food pillars or rules, we used to call them. One of them is that the polite bite. That means that children are required in a family, and by the way, parents too, everyone in the household is required to take one taste of every food that's in front of them. And by that, I don't mean they have to swallow it. There are some kids who are gaggers. They can literally go to the sink and taste it there and spit it out. It is the taste of the food that is registered in the brain as an exposure. And it takes about an average of 7 tastes of a food for a child to actually like the food. Now, sweet foods are going to be a lot easier. It's going to be a lot easier to like a Reese's peanut butter cup than a Brussels sprout, right? Savory foods are foods with more rich flavors like that take longer. But what we have to do is continue to add those exposures, the variety of foods, so that children can establish their preferences around what they habitually eat. Now, here's the deal. If you, Maria, have ever changed to a healthy or eating pattern or some food that you didn't like that now you like, it took several exposures of that to like it. This is true for all of us. It's called neuroplasticity. We develop our preferences around what we habitually eat. If you provide a variety of foods for your child and ask them to taste every single thing, they will develop a variety of tastes and preferences. And what that does for them is huge. Our number one nutrient deficiency is fiber. So we want a lot of that to be vegetables, especially vegetables of color. We could talk a lot about fiber and the mitigation of increase of glucose or blood sugar. But I will say it also increases our microbial diversity, which is something that's been interesting to you and me. And we'll talk more about
Yes,
allergies
yes.
and immune problems. But you really want your kids you want to just make it as a rule that everyone in the family tries everything on their plate. And they don't have to eat it all. They can say, no, thank you. Some people call it a no, thank you bite, so that you're polite. You're polite to who prepared it, whether you're in a restaurant or you're in your home or a friend's home, and you taste it and you Don't overreact. You don't get to make big yucky noises. You get to taste it. That's it. And just be polite about it.
I really like with that 7 things. Like I moved to United States from Russia, so it was totally different story here. And I
Yep.
like that idea of 7. That's how I learned to like sushi.
Yeah, I remember my son when he was little saying to my nephew, he goes, "I don't like this." It was cream of wheat. And he said,
Hmm.
"Take 6 more bites, Daniel, and you'll like it."
Hmm.
And I said, "Honey, it doesn't happen all in one sitting." But even as a 3-year-old, he knew that it takes an average of 7 tastes, and we don't keep count. We just keep saying, "Keep trying. Keep trying." It's healthy for your body. You want good nutrients for your body so you can be good in everything you do. We don't want a child to have a poem that's unwritten or a performance that's unsung or a sports event that isn't played because they lack nutrition. I literally raised my son to be brainwashed, because I believe it too, to know that what we put in our body makes all the difference in the world in terms of fueling our bodies to do great things.
That's nice. It has a philosophical component. I'm going to ask you, especially after COVID, every parent have to carry the sanitizer, and they created ultra clean living environment. That's the like a quality sign on a parent. If you sterilize everything for the child, and I want you to talk about that. Um,
Let
is
me
that
Let me start with that's a conversation we're picking up in the middle, but here's what we're going to start with. We have a microbial diversity problem in our gut. If it's true that our gut manages really all of our autoimmune problems, we look at the skyrocketing of numbers of allergies, food allergies, and environmental allergies, and asthma and autoimmune problems, including eczema as babies. That all has to do with the fact that we're carrying um, half of the we want as many we want a huge variety of bug populations living in us and on us. Okay. In an adult, your gut microbiome weighs 10 pounds on average. We want it to be really rich. So we have a variety of bugs. And right now we're walking around with half of the biodiversity we had just 50 years ago. And a lot of that came from ultra processed food, from a lack of variety of foods, from overuse of antibiotics, from overuse of C-sections, and from lack of playing outside. But what we're really looking at here is trying to improve the amount of gut microbiome. If you are sanitizing everything around you, you are doing your body such a disservice. We have 11 bugs per human cell living on us and in us. If you've got anything in your house that says kills 99% of all bugs, get rid of it. Get rid of it. I know we all got a big scare from one particular bug, COVID, and now everybody walks around with alcohol, hand sanitizer entering your body that your liver has to process. Remember, the skin is an organ too, right? And we're trying to kill all the bugs that are keeping us safe. So we have to be very careful about that. Um, Over sanitizing our environment didn't help with COVID anyway. We know
yes?
this now, right?
And towards that question, I really like how you mentioned about the dogs. I really, it make my heart bleed when I see so many kids with allergies and eczema. Can you please tell on the research what support the claim and what it's good to have pets during the childhood? I really miss that in my childhood, not to have a pet. Now I do.
Well, along with the microbial diversity challenge, we are meant to be playing outdoors. We're part of that community, and we live in these hermetically sealed homes, right? Because it's safe for our kids to open a tablet and stay inside under our watch and control. They need to be playing outdoors in everything except animal feces. We're talking lakes and riverbeds and grass and trees and the forest floor, and come inside and wash their hands with soap and water, not hand sanitizer, right? But what happens is we have a lot of kids playing indoors, and the best we have is dogs that go outside and bring the outdoors in. So there is clear evidence now, and I love the book "Let Them Eat Dirt" and also "Missing Microbes," two great books that really help understand how a dog, not a cat necessarily, because cats generally are indoor cats, and some of them carry The outdoor cats carry a little bit more pathogenic, um, um, what am I thinking? Parasites. But dogs, especially in their fur, pick up a lot of the outdoor microbiome that is so important for us. The other aspect is that we eat a lot of vegetables out of cans and bags and things like that that are stripped of nutrients or grown in air pods in air instead of in soil. Soil is living soil. The more we can, again, eat the dirt that it was in, and I'm not saying don't wash your vegetables. Vegetables themselves have a microbiome. You can't wash all that off, but if they're, we just need to help our bodies understand that we need to be rich in our microbiome, not poor.
Yeah,
Rich.
that's it. Now I want to talk about really hot topic for my practice because I treat a lot of people who cannot sleep and they have a very high palate and sometimes for bicuspids remove and all of that. So can you please talk about use of the pacifier? What is the harm of using the pacifier?
Well, let me tell you, when a baby is born, they come out of a vaginal canal with a head that's only about 20% of its adult size. By 2 years old, it's 80%. So tremendous amount of growth in the head and the midface, right? What we want is the muscles of the tongue, the 16 muscles of the tongue, the flat tongue like this, to form the palate, right? So in order for the tongue to form the palate, because we have a pushing war, right? The tongue muscles are pushing up and out, and the facial muscles and buccinators are pushing in. We want the tongue to win. But if you have any inanimate object, let's say this magic marker or anything in there pushing up instead, your palate is, as a child, going to be formed around that little rubber ball. And keep in mind that if the human race is 200 to 300,000 years old, these little rubber things have just come into our existence in the last, 50, 70, I don't know, 100 years maybe. The fact is, we have seen a big shift in facial growth and development in that time. And the other thing you have to look at is that when you have a pacifier, you have a guard around it, right? So they don't swallow it. That guard, with every suck, there's an equal opposite action. When you suck that thing in, the guard is pushing forward on the growth of the mandible and maxilla forward. So, looking at airway, we're always looking at the lateral dimension, right? Like expansion. What about the forward dimension? We're kind of lost once we get to a certain age where we cannot form that forward dimension. We need the tongue to come up and forward and out of the back of the throat to form a Mellenpatti score that is good for us. We can influence that in babies, but that means really hard sucking, which really works better on a breast, but a slow flow nipple if we're going to be bottle fed, and starting to introduce whole foods when they wean from bottles so they can lateralize their tongue movement and start to chew rather than just sucking on pouches. So we need to recognize that we're so easy on kids in every respect. We want them to work harder to chew and to eat. And so a pacifier really is modeling, pushing up and modeling a vaulted palate, especially if a child has a pacifier in all the time.
But what would be the alternative method of soothing the child?
I don't know that we need one. I think we need to soothe the parents. I think the parents need earplugs. Kids are allowed to cry if they're unhappy. Like, get used to it. It's how they communicate. This is part of the deal, right? To give a child something that just pacifies them so you can be comfortable in your environment isn't necessarily right. It's just what we do. Now, I will say that the pediatricians have touted pacifiers because there's some large studies that have shown a very infinitesimal change in risk for SIDS, sudden infant death syndrome, because kids with a pacifier, a foreign object in their mouth, don't get deep sleep. So then they don't suffer from the risk of SIDS. Now, I ask you, if deep sleep is where neural development happens, why would you want to deprive a baby of deep sleep? So that doesn't even make sense, the premise. But the fact of the matter is, if you are worried at all about SIDS, the risk level drops down after just a few months. So if you introduce a pacifier, it's up to you to remove the pacifier. And I really think that most of the babies I see now, I inform them right away during the infant, for the first couple of weeks, I just avoid a pacifier, and they go, oh, good to know. They do just fine, just like we did for hundreds of thousands of years before that.
That's very nice. Then my last question would be about physical activity. I
Ooh.
noticed for the physical activity was your key recommendation. How can parents motivate and engage their children, particularly in a society where electronic devices compete with attention?
Well, I believe that we ought to, each of us, be moving our bodies every day, not just 3 times a week at the gym, but every day, every day, every day. There are so many, many benefits. I could take a whole 20 minutes just listing the benefits of exercise. You already know that. If we put exercise into a capsule form, everyone would be taking it. It would be our most popular prescription. Unfortunately, you actually have to do it. You have to create the time to do it. So, in terms of building habits of everyday activity for a lifetime of health, you need to model it. Again, model it. You have to do it with your child. And it doesn't matter if it's come up with ideas that you like to do to move with a child, playing outside, throwing a ball, having a dance party in the living room, playing some pickleball, going cross country skiing or snowshoeing if you have snow, going paddling a canoe. We need to be outdoors as much as possible, doing physical activity if possible. And again, if that is a lifestyle and we expect it, then that's how we do it. Now, if you're trying to intervene, you've got a child sitting in front of a computer gaming all day and you can't get them to go outside, I think you just come up with a negotiation. We're going to exchange every minute of screen time for outdoor activity time. That would significantly cut down on screen time and promote physical activity. So I think things like that, those are hard changes to make midstream. But if you start out with that way as a baby, and for many of us, we're going, yes, we should exercise more. It would be good to do that with our kids.
Thank you very much. And I highly recommend to our audience to read the book, Brave Parent, as well as Bubble Mouth. So thank you very much, Susan. We really appreciate those practical advices. And the book is kind of a guideline. Thank
Awesome.
you.
Thank you.